and thank you for attending the webinar today. The topic is engaging and retaining families in children's mental health treatment. And this webinar has been developed by the University of Washington at the Evidence-Based Practice Institute, which is within the School of Medicine and the Department of Psychiatry. And the webinar itself and subsequent and previous trainings that we've developed have been the result of a collaboration with the state of Washington, specifically the Division of Behavioral Health and Recovery within the Department of Social and Health Services. And the goal of these trainings are really to be able to meet the needs of providers. So what we've done over the past year or two with DBHR is develop a number of research projects that really try to look at the current state of evidence-based practices for children and adolescent mental health services in the community mental health agencies throughout the state. And so this was initiated by the passing of House Bills 1088 and 2536 specifically, which encourages the use or mandates the use of evidence-based practice as a primary form of intervention in community mental health agencies. And so we've engaged in a number of activities to, again, try to estimate what the current status is and availability of evidence-based practice throughout the state. And once we were able to get those numbers and get an idea, we were able to then construct a needs assessment to figure out what we still needed to do throughout the state and the different unique regions, specifically within each behavioral health agency. And so we've been collaborating with them to develop these trainings, which we developed from input from providers and from the BHOs themselves. And so one of them that we developed was the engaging and retaining families in children's mental health treatment, as that was cited as a topic that was incredibly important for community mental health. And so this is the result of that. So my name is Jessica Leith, and I work here at the University of Washington in the Evidence-Based Practice Institute. I'll be facilitating the training today, and I'm a licensed marriage and family therapist. The bulk of my professional experience has been within community mental health, specifically with children and adolescents and families, and then I've also spent a lot of years working with children and families in crisis. So I have a lot of experience working with the populations that are coming into community mental health and vulnerable populations in general. I've been doing this work for the last 10 or 11 years, and so I am really excited to be able to provide this webinar and this training because, again, I really believe in the value of not only working with these populations who are considered some of the most vulnerable, but also, how do we keep them in the door and how do we make it useful and successful, which, again, engagement then comes to mind as some of the most important issues towards achieving some of those successes. So I am very happy to be doing this. So we will go ahead and then look at some of the objectives for today. So the objectives for today's training, we hope that you'll achieve an understanding of the current challenges and barriers to effectively engage families in treatment. I'd also hope to help you learn how to identify and problem solve barriers within your own organization or agency, to learn strategies for engaging families at the initial point of contact and throughout treatment to apply in your practice. And then this will also provide, integrated throughout all of this and throughout the slides, there will be updates on the current research related to the engagement of families in children's mental health. So one thing I just wanted to touch on, a lot of these, engagement in general, it feels like a subject that is something that is pretty simple, that is something that we probably learned in our initial training to become clinicians or to work in social services. But I also feel like these are the first line of actions that, because we think they're so simple and we're already doing them, that they're the first to go and to not, they don't become, we tend to focus more on the intervention itself and maybe some of the immediate concerns and issues that get brought to the door, and lose our focus a little bit on that specific engagement piece. And so what this training is really doing is going to be bringing it back to that front and center, that initial point of contact, whether it be telephone or in person, to really focus on these are some specific strategies that we know that have been researched, that have been implemented, that we've been able to see that actually have a huge impact on not only getting families to show up for that initial appointment, but also to retain throughout treatment. So we'll be focusing a lot on those initial point of contacts, and then we will be looking at engagement throughout treatment, because that, of course, is important in terms of getting a successful intervention out there. We need them to continue showing up throughout treatment. However, we want to focus a little more on that initial point of contact piece, because research has shown that actually is, that's basically how we get them there, right? And so that's how we can continue the treatment. And so, we'll address all of those different areas of engagement. And then when we're looking at throughout treatment, we're going to look at some brief motivational interviewing concepts and touch on that a little bit as well. So I wanted to just touch on how we're going to be able to apply this knowledge once you view this webinar and then continue in your work. So I've got a little cartoon on there just to kind of show, which I'm guilty of this as well, how are we going to look at applying what you learned today? How do we know that it's going to transfer to your work with the clients and in your agency? And so I think it just demonstrates how easy it is to go to these, especially webinars. It's easy to multitask. It's easy to be doing other things while listening at the same time. And I think because this is such an important topic that, my hope is that you will be able to focus on this webinar and, hopefully not have to do other things, to really take it in and to think about how you're going to be using this, thinking about current cases, previous cases, what you specifically will commit to doing or need to think about doing differently or the same or continuing once you leave the webinar today. And so sort of a practice or exercise that I've had people do in the past when I've done these trainings live is to write down maybe a few different things, that you do specifically that's really important to you when you're engaging a client, when you first meet them or talk to them. What are a couple of strategies that you really focus on that's really important to you? And so if you wanted to take a second to maybe write a couple, 2 or 3 of those down, just so you have an idea of kind of where you're at, and then as we go through some of these strategies, you can see where you're still falling along the line, and if there's maybe a particular strategy you're not thinking about, or oh, I forgot about that, or I didn't think about that, or I really don't pay too much attention to that. That'll just kind of help you see kind of what you might need to be focusing on as we move forward. So go ahead and do that. Okay. And so when we talk about engagement, again, it seems like something that's pretty simple to understand. And so I wanted to kind of go over maybe, what we might think it means, right? And so I think again, it isn't just a simple answer. It's, there are a few different elements. So, one thing we want to keep in mind is that it really begins the moment a family is considered for treatment and until they are discharged. And so half the time it starts, prior to them even having contact with you. And so this can be with them calling the agency to even make an appointment. If you have separate intake workers, they've got, a person there they're engaging with. And so by the time they get to you for actual treatment, they may have engaged with a number of people already with various experiences. I've been talking to a lot of different agency administrators around their intake process because, they're concerned about the amount of no-shows they have for the actual intake. And so there's actually a lot of strategies that you can use prior to them even getting to that initial appointment with their therapist that can be really useful and impactful. And so I want to think about that as well, because again, it does start that moment they're even considered, and it can go back even to the referral process of who refers them and how they get to you. And so are we looking at what a provider does? Are we looking at what a family does? How the provider or the family feels? Is engagement, do we know we're engaged if it's based on an outcome? If they're successful in treatment, does that mean they're engaged? So these are the kind of questions that we might want to ask ourselves. And hopefully you're all saying that it's all of the above, that all of those are considered engagement. It is what a provider does. It's how they respond, how they act, how they address the client, how they look at them, your tone of voice, your posture, everything. All of that matters, just as it does when we're teaching parents how to engage with their children, right, around behavioral issues. It is what a family does. It's how they respond to you. It's how they interact with you. It's how they participate in treatment, right? Whether or not they even show up. And then how they feel. And so this one's a little bit more difficult because it's hard for us to sometimes know how they feel unless they're explicitly telling us, as well as you. And so both of you need to feel like you're engaged, like this is a collaborative relationship. So these are the things we're going to be addressing as we talk about engagement throughout the webinar. And again, so I have that little reminder at the bottom. And I want you to be thinking about how you currently engage your own clients and families. And if you haven't already written a couple of those practices down, I'd love for you to do that now. So I just wanted to review a couple of community mental health statistics that we have. So, again, this is why engagement becomes incredibly important in terms of getting families into mental health treatment, because we know that 1 in 8 children with a serious emotional disturbance, which causes significant impairment, exists. There's about 75% of children with mental health needs that don't have contact with a mental health system. And no-shows are pretty high. They're estimated between 48 to 62%. And the average number of sessions completed is 2, which is not enough to be able to do most interventions or most successful interventions that have a long-term sustainable impact. So if we really want to be, again, we're working with some very vulnerable populations in community mental health, and we recognize that there are a number of things going on and a number of needs that they have, and most are in high distress. So we really want to make sure that we're able to get them in the door and keep them in the door. So we also know that an engaged client is more likely to bond with their counselor, to participate in treatment, to stay in treatment, and to report increased satisfaction. So again, it just highlights the importance of engagement. Something I also like to touch on is just the reality of community mental health. And so I think most of you are probably working in community mental health if you're listening to this webinar. And so you know that it's stressful, right? I definitely realized through my experience in community mental health that there is a lot of time and effort and a lot of dedication on behalf of the clinicians, the case managers, the parent partners, the supervisors, everybody involved in that process. It's really tough work, absolutely. And there's a lot being thrown at you and a lot being asked of you. And so I just want to validate that and just kind of, let you know that we completely empathize with that. And we know that there's just a lot of demands in terms of high caseload specifically. You've got paperwork demands. You've got, again, these families that are in distress. You name it. There's a number of issues going on. And so, I know that engagement basically is not one of those things that necessarily is, again, thought of as a high priority over other things when you're trying to help them with, a crisis of the day or a crisis of the week, or, with some other logistical barriers around transportation and around, housing, things like that. But again, this is community mental health treatment, and so we're trying to get mental health needs met. And so, again, that's why I think being really strategic and having a targeted focus on engagement strategies in particular about which ones are most useful is going to help us feel not so overwhelmed when we are trying to work with these clients. All right, so now I'm going to go over some predictors and barriers of engagement throughout the literature. So the literature divides these into urban and rural. However, I just want to mention that these aren't mutually exclusive, that we know that there's a lot of overlap between the two of them. And the reason we have them separated is because these are the ones that tend to be more specific to rural areas, and then the ones on the left tend to be more specific towards urban areas. Not to say that, again, that these lines don't cross, because we know that it's not that simple. So in urban communities, parent and family stress definitely has an impact on the level of engagement a family has, the poverty level, and the single parent status. So those are the top three things that we found that impact families living in urban communities. And for those of you working in urban communities, you may see that a little more. And then in rural communities, we're seeing things like scarce mental health resources, transportation issues, stigma associated with mental health and seeking care, concerns about confidentiality, and isolation. And so these are real concerns throughout a lot of rural communities that we tend to see. And so this list certainly is not exhaustive, and I hope it resonates with you all, but I realize that there are probably other issues that you tend to see within your own agencies that are unique to your community in general. But these are some of the top ones that we've seen throughout the literature. So when we're talking about barriers to engagement, we've divided it into two different areas, so logistical and perceptual barriers. So first we're going to go over logistical. When we're talking about logistical barriers, we're looking at things that are concrete, contextual, and then agency-related obstacles. So the concrete would be things like having enough time. If a parent works several jobs, or they're saying, I have all these kids to take care of, I don't have time to get them there to that appointment or to come myself. And then transportation, right? That's obviously a very real issue if they don't have access to a car, and also public transportation. Contextual, so things like community violence, what's the context of the community they live in and whether or not they feel safe to even venture outside, and how that can get in the way of just, even completing behavioral activation strategies for homework, things like that. Cultural issues, so, for some families that have particular beliefs around their culture in terms of how they think about mental health treatment and their level of engagement and participation, that can be a huge logistical barrier. And then agency obstacles, and we're tending to see these a lot more lately in terms of agency practices. So things like, not having enough appointments available or just really long wait times, the amount of paperwork that has to be completed, and then the intake process. So I know some agencies have separate intake workers, and some agencies have the clinician be the clinician and the intake worker. And so there's different practices, again, in the way these things are set up that can create barriers towards engagement. Again, if somebody has to go through 3 different people before they even get to their clinician to begin treatment, that can be a potential barrier, especially if they're getting various levels of engagement from each of those people. So I think that's why looking at some of the telephone engagement strategies can be really important too for those of you that have particular intake workers as well, because there are targeted questions you can ask on the phone that can help get that buy-in and commitment a little more so they'll show up. The good thing about logistical barriers is all of these are real and they're very important, but we also know that these barriers tend to be a little more easier to get past because, if we're looking at our clients in community mental health, a lot of the people we're seeing, they're survivors. They've been through a lot, and they've been able to figure out and navigate their way through a lot of difficult situations. And so this may be an additional one, but a lot of times, not all of the time, but a lot of the time we're able to see them, get through and overcome a lot of these logistical barriers if, again, they find the benefit in it. If they're bought in, if they feel like it's worth it, it's worth their time, a lot, more times than not, they'll try to make it happen. They'll at least put forth an effort. These are also really easy to say. Again, we'll talk about perceptual barriers, but they're a really easy one to say, oh, I can't do it because of this, if there's kind of another concern going on too that we'll talk about. But we know that some things we can do something about. So sometimes with transportation, you can, if you have access to bus passes, that you can give them, things like that. So I know there's some things that you can do, you may have options around, and other things you might not. But again, I also think that we do see a lot of movement in this area in terms of being able to overcome these barriers. So on to perceptual barriers, and these tend to be a little bit more difficult to overcome, and I think it's hopefully obvious in the sense that the perceptual barriers are a little bit tougher to identify also, because it really results in you needing to get this information from the client or family, and if they're not engaged, they're less likely to give you this information. And so what we're finding is that if you're able to, a lot of times people will have a perceptual barrier, and again, like I mentioned, they're referring to a logistical barrier as being the barrier, right? But it's really a perceptual barrier that they just don't want to maybe talk about or tell you about, okay? So that's what we're seeing a lot of. So some of these perceptual barriers, number one would be poor therapeutic alliance. So parents who felt disrespected by their children's prior mental health providers were 6 times more likely to identify more structural and contextual barriers to treatment. So again, pointing to those logistical barriers, they're more likely to identify those if they're perceiving a poor therapeutic alliance with their therapist or social worker or care person. The perceived need for treatment. So, what's their perception of why they're there and if they even need this, right? The perception of the barriers, their expectations for therapy, and then their beliefs about the therapeutic process. So when we're thinking about beliefs, we know that parents who believe that their children's problems were due to physical causes or trauma were 1.5 times more likely to use mental health services compared with those who had other etiological beliefs, such as personality or relationships with friends and family issues or cultures. So those that you buy into the more biological process, or that there's some other kind of background to it that gives justification to the mental health issue versus something they can easily kind of cast aside, where, oh, it's just because they're hanging out with that one person, or they don't like me, or something like that, right? It's easier for them to just toss aside and to kind of argue away. So these are a few things that we need to keep in mind as we're meeting with clients. And then I wanted to touch on adolescent barriers specifically, because this is a different type of population. When we're talking about kids and families, it's one thing, but then when we get to adolescents, we know that there's a couple of other issues that are unique to that population. So we know that adolescents in particular, they have many concerns about engagement and about, again, even going into mental health therapy in general. So they've got a fear of labels and that stigma attached to mental health treatment. There's a lack of knowledge about the need for mental health treatment. And then they don't really know much about the details of the treatment process. And they're also in a stage where they're looking for that independence. So the silver lining in this is that I actually find that adolescent clients are some of the best to work with. I don't know if that's your experience, but once you're able to overcome some of these surface level issues, I find that they actually really like to engage and really like to participate. And this is a great way to empower them and to promote that self-efficacy for them to be able to take a hold of their life and to be able to do what they need to do in order to get, to where they need to be. And so, you first got to address some of these surface level concerns. But at the end of the day, I think that a lot of them tend to really come around and engage in the process. But again, it's kind of getting through those initial barriers that might be preventing them from getting there in the first place. And we've also got some contextual issues. So in Washington State, as you probably know, the age of consent for treatment is 13 years old. And so I think we have to be careful when we're talking about adolescents with that, because they can see that as a sign of not involving parents or not having to engage in general, right, or participate, because if they're 13 and over, they technically don't have to. We know that with parent-initiated treatment, there's a little bit more of power attached to the parents in terms of what they can initiate. So if they, for example, if they want their child hospitalized, they can initiate that parent-initiated treatment if there's availability for that. But there's also involuntary treatment, and so sometimes that can be a barrier in the sense that you can get somebody in treatment involuntarily, particularly inpatient hospitalization, but then whether or not they agree to actually work with therapists is another issue, and also once they're discharged. So I just want you guys to take a minute to think about some of these barriers and to see if they resonate with you, and if there's any in particular you've experienced, and think about how it's kind of impacted your treatment a little bit. Okay, so we're going to go on and we're going to start with the first contact session, okay? And so these are going to focus on particular engagement strategies. And when I say first contact session, I know that that can mean a number of things, and I'm particularly thinking about their first contact with you as their therapist, right? Whether or not they've engaged with an intake person already. I mean, this can also be useful strategies for them, but I also, again, want to think about it when you have your first contact with them, right? These are the things that are going to be really crucial to focus on. So before I get into some of those strategies, I want to talk about some of the research that's been done around these strategies. So a lot of these were developed by Dr. Mary Kay out of New York, and she has done a lot of research as it relates to engaging families and children's mental health treatment. And so not only have they done the research, but they've also worked with a lot of stakeholders to implement these strategies and to see whether or not they're effective, to make sure that it's not just arbitrary strategies, that it's really things that have been tested on the ground, that have gone through feedback with stakeholders and families, and incorporates their, perceived usefulness, or their, how they basically reacted to it or responded to it. And incorporated all of that. So it's really comprehensive, and it's gone through a lot of different phases when it comes to testing these out. So with this particular study, we've got what we're looking at are the number of families that came to the initial and the ongoing appointments. And so it's a particular outpatient child mental health clinic. The sample is 107 people, and then they've all been randomly assigned to each condition. So in the graph here, we've got the first contact results. So if you look at the top line, we've got those, the percentage for the first interview. And so those will be the people in the orange there, red, that were trained in the specific engagement strategies. And the green line represents those clients that came into a contact with a therapist that was not trained in those strategies. And so we looked at the level of engagement across, from acceptance to the third appointment. So if you look, we started 100 with everybody accepting that first session, right? And then we get to the first appointment, and we look at the green line, and we've got a drop-off there to just above 60%. So there's already almost 40% of clients not coming to that first session after that initial contact, whether it was phone or intake. And then if we look at the orange line, we see that there's a significant difference there, in that there was not even a 20% drop-off. So that's a pretty significantly interesting specific data there. That's something that I think really shows the benefits of having engagement even at that first phone call or that intake. And then we look at the second appointment, and again, we have further drop-off for the green line. And then for those on top, we have a little bit, but not much. It still doesn't go below 80%. And then by the third appointment, we have the orange line just drop below 80%, but nothing compared to the ones without the engagement strategies, where it goes down to 40%. So you've got a 60% attrition rate for those that were not trained in engagement strategies versus a close to 80% or 75% for those that were trained. So it's quite a difference, and I think gives value and credit to really focusing on engagement in particular. Okay, so the importance of the first contact. I know we've been talking about that a lot, but here are a few things that we know families really need to experience in that first contact. So the perceived helpfulness. We know that families are less likely to return after a first appointment if parents are skeptical about the possible helpfulness of services. So they need to come in and they need to feel like this is going to be helpful to them. And so you can be clear about it. This isn't, I'm not a miracle worker. I don't have a magic wand. However, here's what I can do, being really strength-based. And we'll talk a little bit more in detail about those. They also need to feel like it's a good fit for them. I mean, this is the point at which many families decide if the agency they are visiting is a good fit. So they need to walk away feeling that. And they also need to feel it right away. And then satisfaction level. If they leave the appointment dissatisfied or with significant questions or concerns, they are not likely to return. So it's really important before they leave and get out that door that you're not just kind of taking their word for it when, if you say, see you next week or at the next appointment, or really kind of get in depth with them about how this feels. Are there any reservations, any concerns? What are some potential barriers to showing up again? So you can address them right then and there, all right? So some of the goals for the initial contact session. Number one, hopefully these are pretty, they feel like something that you should be aware of and have been doing, but we want to understand why a child and family want help. That's the first goal. We want to get their buy-in and participation, and we want to keep them coming back. So those should be the top 3 goals for that initial contact session. So critical elements of engagement, again, there's 4 of them that we'll go into detail on. And the first one is going to be clarify the counseling experience. 2nd, develop a collaborative relationship. 3, focus on immediate practical concerns. And then 4, identify and problem-solve barriers to active participation. So those will be the 4 critical elements that we're going to ask you to really pay attention to when you're engaging with clients in that first contact. So clarify the helping process. When we're doing this, again, these are things that should, we might feel should be self-explanatory, pretty simple, things that we're already doing, right? Basic skills. But again, these are also things that are really easy to overlook. And it's not just, just looking at some of these bullet points here. It's thinking about how you're doing it. So again, when we're working with families and with parents and with kids especially, and we're saying, well, how are you talking to them? Did you yell or did you talk softly? When we're looking at how a child's reacting to them, right? I think we also need to really pay attention to that as therapists as well. Are we exhibiting a welcoming stance, a welcoming posture? Did you have a tense client beforehand? So really paying attention to your own stance and kind of where you're at in your own presentation, right? Are you inviting them to that conversation? Do you feel like you're creating a welcoming environment? So really thinking about that ahead of time, right? Because they're coming into a situation, again, they could have had a previous negative experience. They could have no experience and not know what to expect. And so you're really kind of setting the scene here for, whether or not this is going to be successful or not. So again, you want to introduce yourself briefly, and all of this should hopefully happen pretty briefly. You want to talk about maybe your agency a little bit, the service options, any paperwork that needs to be completed. Something very simple in terms of, I'm Jessica, I'm the therapist, I'll be working with you guys. This agency has been around in the community for 20 plus years. People really trust us. We do a lot of things. We do a lot of community service events, things like that. Get them to feel a little bit more comfortable about the agency you're working with. And then service options. We've got access to parent partners, or I can provide bus passes. We've got the ability to go into the schools or in the community, just being really clear and upfront about some of those options. And then paperwork. I have a couple of paperwork items that I need you to complete, so it could be a release of information, right? And also really telling them the benefits of this paperwork and not talking about, I know it's a lot, I know you've already done, I don't like it either. That can seem very validating towards them, but actually, we really need to stress the importance of these things, right, about that there's value in doing them, okay? So we, again, want to take a really strengths-based approach around everything, even annoying things. We don't want to assume that the client has been given accurate information about services, so you really want to explain the purposes of these services. So again, you want to ask them around, what's their experience with counseling? What do they think about it? What have they heard about it? To really kind of get at some of those perceptions. And then telling them what it really is. It can be a great way to learn new skills. It's not just about you guys sitting there in a room playing board games together either, but this is where you come to actually work on some of these issues, right? And to be able to hopefully empower yourself to be able to take care of your own problems moving forward, right? So again, taking that strengths-based approach. And then asking them, what they've already heard from other intake workers and things like that. And we don't want to assume that they know what's expected of them either. This one's key because I constantly hear from people, that there's miscommunication, or that, well, they are saying that they thought it was this or something like that, and that's way after the fact, right? And so that's why it's really key in these first initial sessions to really clarify, here's what this is about, here's what I can do, and this is what I need you to do, right? Clarifying those expectations early on. So it's much easier to talk to them about what you expect from them, the parent especially, in their role, in their participation, than down the road and saying, well, I thought, it would be really useful to have you involved. And they would say, oh, well, I thought it was just going to be for my kiddo. I mean, I brought him in. He's the one with the issues, right? It's so much easier and is so much less work for you if you can address these things head on and to let them know. For example, if they're bringing, their 6 or 7-year-old kid for behavioral issues, you can say, it sounds like you're really, struggling at home, and really set up the importance of being able to have them participate in that treatment, because with behavioral parenting interventions in particular, those are not successful without parental involvement. Okay, there's minimal work that a small child can do when it comes to their own behavior. When they're a little older, of course, you can work on more behavior management strategies and self-regulation, but we still need the people who are interacting with them and setting those boundaries and limits on a daily basis to be involved. And so we want to explain that to them and make sure that's clear and that it's a supportive thing too. It's not about, that you have done something wrong and so you need to be a part of this because your parenting is bad. We don't want to say that. But we want to let them know that, this works best in this type of situation. And so for it to be successful, we need that. And again, this is also a place where you can address some of those potential barriers to them being able to participate. And this doesn't necessarily mean that they have to participate on a weekly basis, because we know not everybody has the time to do that. But at least getting them to commit to something, right? Whether it be, every couple of weeks or even once a month, but something that they are able to commit to, that you talk to them about around the importance of that. I also mentioned evidence-based practice in there because these are interventions in particular that follow a particular approach, right? So there's you have to have people attend in order to be able to cover a lot of those strategies. You can talk to them about their, time focused, and that they're, brief. A lot of them, they really target specific areas, and here's some of the things we're doing. And you probably want to talk about it specifically if you're thinking even about working with trauma, and especially if you're doing trauma-focused CBT. You're going to want to tell them about what the expectations are, because there are some expectations in there around trauma, and then we need to know ahead of time if that's going to be an issue for a parent who may have some of their own trauma that they haven't worked through. So again, talking through some of that treatment process and what you might be doing with them as well, so they kind of get a heads up of what that's going to look like, how long, sessions in particular, homework, things like that. So the second thing we want to focus on is developing that collaborative relationship. Again, the parents need to feel like they're part of a team, okay? You don't want to create a situation where it's you against them or them against you. So, the parents, I got this question once where somebody brought attention to the fact that, we say a lot that to the parents to empower them, like, you guys are the expert in your situation because you know what's going on. But that can also be troublesome in the sense that then sometimes parents say, well, you said, you know, I was the expert and I know what's going on, and I'm saying that's not going to work, right? So it kind of gives them some, you know, a way to maybe disengage a little bit as well if something's making them feel a little uncomfortable. And so we want to be careful about that. So one of the things we talked about doing was just really being strengths-based about that in the sense that, you know, I'm an expert in this area and I've got this training and these skills and support that I can provide, and I consider, you know, but you're the one at home, you're there dealing with it all the time, and so I really rely on you to provide that information to me as well, okay? So really kind of showing them the value of each of your roles in this, right? And that you do value theirs as well. So within this, we're going to look at if you're reviewing intake information that they've given, then this would be a really good opportunity to kind of briefly ask about maybe a couple of those pieces, you know, just to make sure it's correct, because we know that sometimes, you know, they may not be ready to give some of that information at that time, but just to verify a couple of things. It says here that, you know, this happened, is that accurate, or is there something, you know, anything else that I should know about? So just ask them to maybe briefly describe, you know, a couple of things that are most important that's going on right now that brought them here. And, you know, you want to hear it in their own words, right? You know, they've talked about it already, and it's really important for you to hear it from them in particular. And you want to also talk about how you can help them here. You know, you're here to help. And again, we talked about not having a magic wand or being able to make miracles happen, but, you know, this is how I can help, right? And knowing what you can do. And this is also a space where you can maybe problem solve. This is where, you know, when you're developing a collaborative relationship, where those perceptual barriers are going to come up, because within that you have a therapeutic alliance, right? Their beliefs about the therapeutic process, their perceived needs for that treatment. So you don't want to attend to any of those that might be an issue. Specifically, any previous negative experience with professionals that would be helpful for you to know about. I want to ask about that one specifically because there's a lot of things that could come up there. And then again, I've been saying this a lot, but this in particular, to develop that collaborative relationship with the parent by using validation and praise. So just really promoting that self-efficacy. Because again, you know, you're gonna see less resistance if they're feeling validated, if they're feeling heard, if they're feeling like they're contributing to that process, and that they're, you know, again, they're being taken seriously, because most likely they do have very valid concerns, right? And they're probably overwhelmed and going through a lot. And it's not that they're trying to be so resistant, you know, it's a really negative word, but they're really just trying to survive and get through this situation, and you're asking them to do even more. And so, you know, I think we really need to sit and think about that and about their unique experience and then what that means to them. And I think you'll be able to break down a lot of that resistance and those barriers. And they'll feel, again, a little more empowered to be able to participate more and to do more. So really harnessing their strengths around, and then using validation and praise as your tools. So the third thing we're going to do is focus on immediate and practical concerns. So scheduling the next appointment, something as simple as that. That can be something, depending on the situation, if there's a lot of concerns that you have, then you probably want to get one sooner than later. And you want to get a commitment from them right now. So don't give them an opportunity to say, I have to go look at my schedule, or I'm not sure. That's going to be indicative of a perceptual barrier, right? Even if they're saying it's a logistical barrier because they don't know their work schedule, or they don't know if they have a ride, that's kind of a red flag where you want to get out to, well, let's go ahead and set one now, right? Or what are you concerned about in terms of getting that appointment set? What's, you know, and letting them know the benefits of having that, and then they can call and cancel if they need to, but really getting that commitment from them right away before they leave. The other thing is parents often need help negotiating with other systems. So, for example, a school. If they're there, you know, if they're having issues with school and the school maybe wants to, you know, expel or suspend or something like that, showing them that you can actually do something about that. So, would it help if I attended the next school meeting, right, with that principal? Because, again, they may be feeling like everybody's against them and they don't have any supports, and so having somebody like you there might be really useful and a way for you to show them that you are helpful and that there are things that you can do to help support them. So this is attached to the next one where we're looking at the benefits of responding to parents' concerns. It provides that opportunity for workers to demonstrate their commitment and potential capacity for help. So we talk a lot about actions speak louder than words. So you can tell the parents what you can do, but showing them is going to mean a lot more. And it's not that you have to do all of these things and overwork yourself beyond your limits, but taking one specific thing that you can attend to, right? So again, you can't solve all of their problems, but what can you do? So I find that there's a lot of value in picking one thing in particular that they've identified as a problem, and you could say, I could do this. Would that be useful? Would that be helpful? And just really giving them something to feel like, okay, something's happening, and that can help get them to buy in a little bit more. I think what I also like about focusing on immediate and practical concerns is that this is really important because it's also really easy for clients to get off topic and to bring lots of different things into the equation that aren't really relevant to the current situation. And so we also want to use a lot of redirection here and keep them focused on the issue at hand, right? Because I'm sure, especially if it's their first time around somebody who can really help them, they may be throwing a lot at you. And that can feel overwhelming and depending on your own personal limits or ability to set boundaries, that can be a challenge. So, I think this is an area where we need to focus on, 1, 2, or 3 really immediate, specific issues that you can attend to that are most relevant to the current, target or treatment plan or presenting problem, and then focus on that. And then, we'll look at what we can address elsewhere later. But unless it's, not a life-threatening situation, of course, you want to attend to that. But otherwise, we need to try to be as targeted and focused as possible. And so the fourth element is identifying and problem-solving barriers to counseling. So, and this one is particularly important because, again, the barriers are why they're not going to keep coming back to. So you want to explore any potential barriers to participating in ongoing services and problem solve. Okay, this is a great way for you guys. I mean, if you have done everything else and now we're going to problem solve, now we're going to see what we can do in order to keep you coming here. So you're going to look at specific obstacles, especially like time and transportation. Absolutely be asking those things. What could prevent you from participating in treatment or even coming to the next appointment or even being involved in the kiddo's treatment, right? And then there's some specific ones that we've pulled out. So previous negative experience with helping professionals, discouragement by others to seek professional help, even attending to differences in race or ethnicity between the interview and the client, families, if they've had previous experience with racism in the system, these need to be carefully explored. And then, is there an overall lack of motivation? What is their level of motivation towards, engaging and participating? And then anything else that you can think of. So you're really going to want to look at any potential obstacle. I mean, again, you could spend an hour going through every potential barrier, and you don't want to get weighted on those barriers, but you want to use them as a strengths-based problem-solving opportunity. So maybe you could, again, be really direct about it and say, give me, a couple of reasons, top reasons why this might not work out, right? And then if they're unable to come up with any, then you can maybe suggest a few things that we talked about today. Okay, so my colleague and I are going to role play the 4 critical elements. It's one thing to go through all of those, but it's another to kind of hear them in practice. And I apologize, I don't have a webcam on my computer, so we're only going to be able to do it over the audio here, and so you won't be able to see us, but you will be able to hear us engaging. And so what I really want you to pay attention to, what we should be doing, hopefully we are doing, is that we're going through the 4 critical elements that we just outlined previously. So hopefully you were paying attention to that, and I just want you to be kind of thinking and listening to what you're specifically hearing, and then being able to attach those to within the critical elements that we just talked about. So, Kathia, are you ready?
I am.
Perfect. Okay, so we'll go ahead and get started. So, this is Jessica, and I'm going to be the therapist, and then my colleague Kathia is going to be the parent of a client that I'm going to see for the first time. And so she is coming to see me in the office. Okay. Okay, so hi Kathia, my name's Jessica. I am going to be your therapist at Community Health Services here in Seattle. So I just wanted to take a moment to talk to you a little bit about myself, and then what kind of services we provide, and then just maybe a little bit of information about the agency in general. And then just, again, I said services, but also counseling in particular, and some of those expectations. Does that sound okay?
Yeah, it does.
And do you have any initial questions for me off the bat, or is it okay to just go ahead and start?
No, just go ahead.
Great. Okay. So again, my name's Jessica. I'm a licensed marriage and family therapist. I've been working with families and children for over 10 years now, and I've been at this agency for about 5 years. So this agency has been a really great place to work. We work with a lot of children and families. That's one of our expectations within the community, is that we take a lot of referrals from the schools and from different organizations to families and children experiencing any kind of mental health issue. And so I think they've gone over the payment structure, but let me know if you have any questions around that. And then I just also wanted to see if this was your first time in counseling, or if you've had any other experience.
No, this is my first time.
Great. Okay. So counseling can look differently depending upon who you go to and where you go. And so here in particular, my approach is, I was trained in a particular style, and that happens with a lot of therapists. And so I like to use more targeted approaches, in the sense that, like, if you're coming in with a specific issue, or your kiddo is, that we're going to kind of identify where the problems are and what the issues are, and then we're going to pick a particular intervention that basically addresses that. So it'll be things that are very specific to reduce, behaviors or those symptoms or whatever it is that we're looking at. And it generally has to happen across a certain amount of sessions, so participation is really important from both you and from him, because there are certain things that we have to accomplish in order for it to be successful. So I'm really excited to work with you and with him, and I'm hopeful that you are interested in participating as well, because I think that's where we're going to get the most benefit from it. Do you have any questions about that?
No, I don't actually.
Okay, great. So I also I have some intake information here, and it's quite extensive, so I don't want to go over it too much, but I'd love to get from you in particular, if you could just give me a brief couple of sentences about what the particular problem is that you brought Michael in for.
Yeah, so Michael's having some aggression problems in school, and he's kind of acting out and being aggressive towards, his schoolmates, and it's also kind of affecting him and his siblings or my other kids at home, and just a little. That's kind of why we're in today. We're a little concerned about how aggressive he is towards his peers and family members.
Okay, absolutely, great. Yeah, that's what I have here, and I just wanted to make sure that that was still, what's currently going on. And I can definitely empathize with that concern. That must be really hard to have other siblings in the home and then have to worry about one of your other children being harmful to them. So I certainly think that that's something that we can help you with. I actually have a lot of other clients in the past and currently that are going through similar circumstances. So the good news is that there are a lot of tools that we can use that will help with those behaviors and help you manage those behaviors, because that's really what's going to be the key to reducing any kind of aggression at his age. So So we definitely can start working on that in particular. And again, I talked about those expectations. So, with any kind of parent management intervention, we really need the parents' involvement because we know that the best way to really reduce those symptoms is for you to have the tools to be able to manage those behaviors. And so those aren't necessarily things we can teach him. We can certainly try to work with him around being able to control his behaviors a little better. But that's going to work much better if he's got somebody at the home who's dealing with him all the time that is able to also have some tools and strategies and support around managing those in particular. So does that sound like something that you'd be able to commit to?
Yeah, definitely. Especially for Michael's sake, I completely understand.
Okay, great. So, and we can talk a little bit about what that looks like because it's a little more in depth, and I'm not going to ask. There's a commitment, but also I recognize that you have other things going on as well, and so it sounds like you've already been doing a lot, and I just really appreciate you bringing them in. And I think that's a huge first step, just getting here. And so hopefully, we can just move forward and get some of these taken care of for you pretty quickly. But again, sometimes I don't have a magic wand, so it doesn't always happen that quickly, and we may, there could be setbacks and things like that. So, but, I can definitely commit to supporting you and hopefully working with you around these things that come up. But the goal is that, I can help support you and I can help teach you these skills, but really you have to be the one to implement them in the home, as that's really the only way it's going to work. Because, again, I only see him for a short period of time, you and him. So that sounds great. I'd love to get a next appointment scheduled with you. I've got quite a busy schedule, so if we could get that in the books, that will be much, I think, pretty beneficial for both of us so that you kind of know, you have that appointment to look forward to, especially if there's some behavior in the home that you're frustrated with. Can we go ahead and get that set up?
Yeah, I'm just looking, and with the holiday coming up and then the other, and we've got vacation and school and all the other kids. I mean, I really want Michael to start getting better, but I don't know. I'd have to look at my calendar and then look at everyone else's schedule and kind of see if, what would line up right now. I don't want to commit to something and, I don't know if I can. Could we do
Yeah, I
something later?
totally hear you. I totally get what you're saying. So I definitely want to make sure that 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 makes total sense to me. On the other hand, I also want to make sure that you're getting the support as soon as possible. And so I know it can be really difficult to wait too long after these first sessions, and it can become harder to kind of make that phone call. So I'd love to make things a little easier on you and at least just get it scheduled. And again, this is voluntary, so you have the ability to call and cancel it at your convenience, but I would hate to have you call in a week and then me not have anything available for a couple of weeks, especially if there, a particular instance or situation that happens. I think it would be, from my experience, it's a really great idea just to have that next appointment scheduled and in the book so that, we can use it if we need it, and if you don't, then great. But, at least to kind of get things going and to have something to look forward to. So, I can be flexible around that. Can you commit to doing that?
Oh, yeah, definitely. If flexibility is there, then for sure.
Perfect. Okay, so I'll make sure we talk to the registration desk where you walked in when we walk out of here. But we'll go ahead and look at that, okay, in terms of availability. So I also wanted to touch base on a couple of other things. So are there any other systems that you're currently involved with that would be helpful for me to talk to, like the schools or anybody?
Just the school, but no, that's it's just the school.
Okay, great. So it might be really useful for me to get a release of information for them so that if there's somebody in particular, like a teacher or somebody you want me to talk to, that we can do that. Any issues with that?
Oh, no, that would help a lot, actually.
Okay, great. And so, I was just thinking around just being able to problem solve, around any of the current issues going on. So I know we don't have time to spend too much time around, all of the behavioral issues. But if you could, what I can do is leave you with a couple of, parenting management techniques to try that you can leave with today. I've got some particular sheets that we can go over on that. Would that be useful?
Yes, it would be very useful.
Great, great. So we'll set that up as well. And then I also wanted to figure out if there's any other barriers that might keep you from getting here in the next appointment. I know you were a little hesitant to get that scheduled, so I'm just, thinking around, is there people at home that are supportive for this, or are there any kind of transportation or time issues you're thinking about? We need to adjust now.
Yeah, there might be a transportation issue, with the buses and such, but
Sure.
I think I have it pretty squared away.
Okay, so so do you have your own transportation, or it sounds like you're going to be taking public transportation?
Yeah, the public transportation, it seems more convenient for us at times, and sometimes it isn't.
Okay. Well, I can make sure that I have the bus line and the times and all of that information for you, so you know how long it's going to take you to get here. And then we also have some bus passes that I can give you up at the front desk, if that would be useful.
Oh, that would be amazing.
Great. Okay. So how are you feeling? I know that this can be a little tricky and a little scary coming in, and we're asking you guys a lot of questions and asking you to commit to things. So I just wanted to kind of see where you're at in terms of, continuing and participating and working with me, and how you're just feeling about the counseling process in general.
I actually feel quite a bit better, loads better actually. It's a lot more relaxing and calming than I thought it was going to be.
Great, that's great. So again, I really, really want to have open communication with you. So even if you're feeling things or thinking things that you might be concerned about addressing with me, but any potential concerns that you have, I would really appreciate you just bringing them to my attention, and I'm happy to chat about them with you because, again, this really works best when you and I are on the same page and you're feeling connected and like you have a voice and a say in this. And so I just want to make sure that, you're able to come to me with kind of any issues or concerns or any questions that you have. So that's important for me to let you know that, and I hope that that's not an issue.
Okay.
Great.
No, yeah.
Okay. So if you don't have anything else, then we'll go ahead and set that appointment up with the receptionist. Does that work?
Yes.
Okay, great. Okay, so that's not exhaustive. That role play, obviously, sessions can go a lot longer than that, but what we really wanted to try to do was to kind of touch base on those really important elements that we just talked about. And so, again, I was trying to do that in a really condensed frame of time, and so, again, we don't have time to go through every particular thing. You'll want to elaborate on those a little bit more in those sessions, but hopefully it gives you an idea of kind of just quickly going through some of those things. And so it could help to really write down these 4 critical elements and just have them sitting there in a list on your office that you can refer to if you need to, just so you know that you're kind of like a little checklist even, right? You've got, a mental health status examination that you go through, and this could just be something in addition to that. Okay. So now we're going to go ahead and talk about engagement strategies throughout treatment. So we're looking at retention here. This is after that first contact. Hopefully they're coming back, and so how do we keep them engaged then throughout treatment so that treatment is successful? So some of the strategies throughout the literature that we're looking at, one element that's really important is addressing the parent's concerns throughout treatment. So this is really important because, more often than not, a parent's not going to stop having concerns after that first session. And especially if the kiddo's not getting better or there's other stuff going on, you want to make sure that you're asking about that and you're attending to it and you're not brushing it off, okay? And thinking, again, if we have to be really careful not to move to, oh, they just don't want to do this or they're resisting this treatment, but to really reframe it in a strengths-based approach, like they're coming to you for a reason, and so why is that? And getting to the bottom of some of those concerns, right? So you're going to have to be pretty explicit in asking them these questions because, again, they might not feel comfortable to bring them to your attention. So really asking them directly, and being brief. What's the top concern right now? We don't have to ask about every single concern, but what are the top things that are impeding treatment right now? And again, make sure you're attending and validating and praising and really promoting their empowerment around what they do bring up, okay? The other thing is using a paraprofessional and professional clinical staff. So parent partners, parent advocates, or case managers, know what you've got and know how to use them. These can be really, really helpful to you and help from burnout and from your own frustrations if you can have access to somebody else that can help support the treatment as well. And letting them know that these parent partner might be better able to work with you around some of these things, right? And again, I can't emphasize enough the strengths-based approaches. So you really want to make sure you're partnering with and supporting the parents and, using the praise, empathy, and self-efficacy as a tool to your advantage. Some other engagement considerations. So we've got special populations on there and trauma and disruptive behavior disorder in particular because these ones might require a little bit, the same strategies, but just how you use them may be a little differently. So with trauma in particular, again, this is a really difficult diagnosis to work with if it is actual PTSD. We don't want to push too hard, right? And so we don't want to push in general, but we want to be especially sensitive around how we're engaging them around the trauma piece, right? So keeping that in mind in terms of their comfort level. And then with the disruptive behavior disorder, we kind of have a different set in that they tend to be more defiant, right? So people who are more opposed to maybe engaging in treatment. And so, working around that a little bit more and being strategic around how you bring them into treatment and engage them, and making sure that it's not you as kind of this person in charge telling them what to do just like everybody else, but really this is a great way to foster a collaborative relationship with those kiddos as well. And then something we call accessibility promotion. So this is the ability to go to the client's community. This has been shown to be really helpful if you have that capacity at your agency, being able to go to their school, and then, or, the home, somewhere like that. But being able to meet them where they're at, or at least kind of alter the treatment a little bit, can help. It can also help you, if you're able to go to their community, get a little bit of a better context for the situation they're coming from, too. Okay, a couple more. So homework assignment. Homework has actually been shown to really help clients feel engaged a little more, and parents, because it gives them things to work on while you're not in session. And hopefully they're things that are helping, and so they can come back and then report positive impact there. And so homework in particular, got a brief definition there that it's therapeutic tasks given to client to complete outside of session to improve treatment adherence, with the goal of reinforcing or facilitating new knowledge or skills that are consistent with the treatment plan. And then you've got appointment reminders. So these can also come in really handy. So being able to, have staff or the therapist call and remind them about the day, time, and location session. You can do mail, text, phone, email, but this helps to increase session attendance and reception and services. So these are some really basic principles, but again, that can go a long way. Okay, overcoming resistance. So again, I don't really love that word resistance because it doesn't, again, feel strength-based, right? But this is, so I think what we might better call it is just, well, I guess I don't really have an alternative word for resistance, but want to think about it in the sense that, working with, we also don't want to call it difficult clients or things like that, difficult parents, right? So you really want to think about how you're calling it. But this is really where we're going to assess caregiver commitment and willingness to participate in treatment. So this is where we're going to briefly go over some motivational interviewing concepts. So some of this might seem familiar to you. And this is the stages of change. So this is a typical motivational interviewing approach. And so what we do is we look at, Generally, when we're working with people around certain issues, they tend to fall into these different stages in terms of where they're at in motivation and participation. So we'll just briefly go over those. So in stage 1, we've got pre-contemplation. So in this stage, we generally see a denial of a problem, and so they don't see any need to change, right? So they're minimizing, blaming, and just not participating and seeing a need for it. That's what we tend to see. So your task would be to raise the parent's awareness of the problem and the possibility of change, right? So you don't want to give prescriptive advice, and you want to avoid confrontation. That's key throughout all of this. Try not to get yourself in a confrontation with the parent or become argumentative with them. And in stage 2, we've got contemplation. So this is where you would acknowledge a problem exists, but the parent considers change but also rejects it. So they may feel ambivalent and may often feel stuck, and they can argue for and against change. So your task in this stage would be to address that ambivalence. You can discuss reasons and benefits for change and the risks, consequences of not changing. So your goal is to kind of help the parent tip the balance in favor of change. And in this stage is where you can utilize what we call a decisional balance scale that helps them kind of look at what are the pros and cons of changing, what are the pros and cons of not changing. And that's in our resources on a couple more slides here that I'll point out to you. And then in stage 3, we've got determination. So this is a stage where a parent has decided to change and wants to do something about the problem. So there's now a window of opportunity for change, right? So your task would be to help the parent identify best actions to take for change and then support their motivation for that change. So you would help them find a change strategy that is realistic, acceptable, and accessible, appropriate, and effective. So something really simple to start out with, right? Okay, and then stage 4, we're looking at action. This is where a parent takes the steps to change. So the parent engages in specific actions to bring about the change. Okay, this is where they're really involved in treatment, and they're saying, okay, I'm going to do this. Yep, all right, this is where homework comes in. And so you want to help the parent implement a change strategy. This can be setting more boundaries or looking at rules and consequences especially. So you want to support and be an advocate for the parent, and you want to identify any available sources of support for them. And then the final stage is maintenance and relapse prevention. So this is where they're actively working on sustaining the changes that they've made. But the challenge during this stage is preventing, that relapse or going back to the status quo. So you want to help them, this is where you want to problem solve some of those barriers, what could potentially get in the way, or encourage, things to go back to the same. So you want to help them identify those triggers, and especially if we're looking at, how they're parenting, things like that, and then how to develop some coping strategies to prevent that. So this is where that self-efficacy piece really comes in, because the goal is that we're building them up, that we're empowering them and teaching all of these skills so that they can take care of their own problems in the home and themselves, not that they fall down and forget everything they've been taught and come running back to you. So the way we accomplish all of these things within motivational interviewing, they like to use basic attending skills to conquer resistance, which they call ORS for short. So the use of open-ended questions, and hopefully these are things that you've already been taught, but again, it's just kind of reinforcing that these are some of the key things you need to think about when you're communicating or interacting. So again, open-ended questions. So what kind of change would you need to see from Susie in order to feel like you can trust them more, for example? Not giving them an opportunity to shoot you down with a yes or a no, right? We want them to elaborate. Affirmation. So, affirming what they're doing, that's a good approach, or that's what you want to see from them. Also reflective listening. So, okay, you're telling me you want to have a better relationship, or you're saying this, right? Reflect back what they've said to you so that they know you're listening. And then you want to summarize, right? You want to make sure you've got it right. And say, okay, so what's most important to you in your relationship with your daughter is trust. Really summarize everything they've been saying and ask them, is that correct, or did I miss something? Is that what you meant? Again, it's really important not to assume that you know what they mean and to clarify anything and to make sure that you are on the same page. And then there's a few more principles that we want to look at with called REDS. And so the first one is roll with resistance. So I know that they have actually changed resistance, and I apologize that that's not updated on here in our version. But again, we want to be careful around the use of the word resistance and find something a little more strengths-based. So this is where you'd find a way to connect with the parent, and you would avoid arguing or conflict. Expressing empathy. So I know this is something we've already talked about, but definitely make a genuine effort to understand the parent's point of view. You want to develop discrepancy, so you want to work to understand and make connections between a parent's goals, values, and behavior. What are the discrepancies and what are the challenges? And then support self-efficacy. So you want to support the parent's hope that change is possible. And you want to have opportunities to identify when the problem does not occur. So again, that is all taking a really strengths-based approach. And so these can seem like simple strategies, but they're also very easy to overlook. And so you can easily write these down or have these listed on your desk or in your office and just kind of refer to every once in a while so they're on your mind when you're meeting with these clients. So that's it in terms of all of the strategies and the content of the webinar. I know it's a lot of information to sit with, but I wanted to be able to provide you with some resources that you can actually find on the CBT Plus website. So they are part of the University of Washington at Harborview Center for Sexual Assault and Traumatic Stress, and so they have graciously said that we can use their the handouts that they've created, and they have quite a few on their website. And so I've put the link there that you can copy and paste into your browser to go to. And you'll be able to find, in particular, what I referenced here was the decisional balance scale. And then you'll also be able to find the engagement and motivational enhancement handout, and then the stages of change handout. So a lot of those ongoing ones. And so hopefully you're able to write down the 4 critical elements. Those would be really useful to have when you're meeting with the clients for that initial contact session. So one more thing in particular, though, that I do want to review is the telephone contact. So I know that that's not always relevant to everybody, but I want to make sure we touch base on it for those of you that do have that initial phone contact with the client. So really briefly, the goals for that telephone contact, again, we have very similar research that shows huge benefits for being able to focus on these things in those telephone contacts that we did with the outcome research on the first contact engagement session. So there's definitely a lot of value and support for this as well. So again, those goals that you're going to be looking at for telephone contact in particular, you really want to clarify the need for the mental health care. So it's very similar to the 4 critical elements we've already talked about, but a little more condensed. You want to increase their caregiver investment and efficacy. Number 3, you want to identify attitudes about previous experiences with mental health care and institutions. And 4, you want to problem solve, especially around any concrete obstacles to care. So you can easily do that in that telephone contact with them. So make sure you have these written down. I'll give you a moment to do that. So some of the strategies in order to be able to accomplish those goals, number 1, gather perceptions of their concern. So you want to ask specifically, how long has it been going on and where is it happening? And all of these can be really brief, right, but targeted. You want to get their perception of services and helpers. So you want to ask, what about the teachers, the counselors, the providers? What do they think, or who referred you? And then you want to define the concern. So you can have them give a recent example, and especially because we tend to see a drop-off from making that initial appointment to them actually coming to the appointment, this is a great opportunity to say what happened why are you calling right now, basically? Like, what happened to make you call right now to make this appointment? And this is also where you can attend to, then not dropping off between now and when that appointment is actually taking place, but, how long has it been going on, right? So you can know, is it a chronic or kind of a up and down problem? And so just really stressing the importance of being able to come to that appointment because, it sounds like, again, they've been really going through something and, we don't want to have to re-get that appointment. We'd love to get them going pretty quickly. So just, problem solving around any potential barriers to getting to that actual appointment that you're making on the phone with them. So this goes into getting their buy-in, right? How services can be helpful and make a difference for the parent and child. So you want to throw a little nugget at them. You want to let them know, again, how it can be helpful and useful. All right, so finally, I really would love it if you guys could just reflect a little bit on what we've talked about. And in particular, I know that we don't have an opportunity to engage, but I want you to think about, what the similarities are between the new strategies and your current one. So going back to in the beginning when I asked you to write a few things down that you'd been doing already when it comes to engaging with your clients, really think about, maybe I could do this a little better or a little differently, or I'm already doing that, so that's great, But thinking about how you can implement that into your practice or what you're going to be doing. And so thinking about what some of those differences are. And I just mentioned how you're going to incorporate that into your practice. You can problem solve around your own barriers. What do you think might get in the way, and what could prevent you from focusing on these things, right? And so how are you going to commit yourself to staying true to some of these strategies? And thinking about specific case examples where you are currently experiencing some of these barriers, and how would you apply these concepts, right? And has your perception changed? And will it change how you deal with it in the future? So just some reflection questions for you to think about on your own as you're moving forward before your next appointments with your clients. So I know, unfortunately, we're not able to answer any questions. You're certainly welcome to email me if you do have questions about any of these. And my email is M as in Mary, leith@uw.edu. So again, you're welcome to email me any questions you have about any of the material or any of the strategies or concepts we reviewed today. Happy to answer those. And if you have any questions about the work we do at EBPI in general. So hopefully this has left you with some useful skills and some knowledge that you'll be able to start using and implementing right away. And hopefully you're feeling like you have something to move forward with. So I really appreciate you viewing the webinar today. And again, good luck. And we wish you success. Thank you.